I started going to a chiropractor. Didn't get much relief, but he wisely ordered x-rays and MRIs that showed the problem with stenosis. Because I didn't respond to the chiropractic, I went to see an orthopedist. He saw as well the stenosis, recommended physical therapy. I didn't get much improvement from that either. Pain continued to escalate. We're now around November, December of 2012, and I realized I needed to see somebody who could possibly help me, a surgeon. A friend who I had seen in September 2012 mentioned he had similar pain. He had been helped by Dr. Steinberger, so I made an appointment with Dr. Steinberger, and I got to see him in December 2012. It was very important for me to find a doctor who was also a participating doctor at the Englewood Hospital and Medical Center, because non-blood medical management was critically important to me and my family for our beliefs as Jehovah's Witnesses. And so Dr. Steinberger met both criteria: extremely skilled, and he was participating and would respect my wishes for non-blood medical management for the surgery. And I remember when I met him for the first time, I was just impressed, just with him walking in, and he told me, he had looked at my MRIs and my x-rays before, and he said to me, "I know what's wrong with you, and I can fix you." And I love that, because here for 9 months I am suffering. It's getting worse. Nobody really knew. I tried all sorts of treatment, nothing responded. And now somebody says, "I know what's wrong, and I can get you better." That was music to my ears.
I first met Mr. Jerrold in December of 2012. He presented with a history of chronic low back pain with radiation to the legs that had not responded to previous treatment by chiropractors, orthopedic surgeons, physical therapy, and various medications. I took a detailed history, did a physical exam and a neurological exam, and reviewed his x-rays and MRI scans. And I felt at that point we should try further conservative measures in an attempt to relieve the symptoms and try to avoid surgery if possible. We had attempted various other conservative measures in an attempt to improve the symptoms without surgery, but they did not work. Because of his persistent symptoms and his signs and the findings on his various x-rays and scans, it was decided that he needed surgery to get pain relief. Because Mr. Samuth is a Jehovah's Witness, we're very sensitive to their specific needs, and we've developed a program for all Jehovah's Witnesses, and we've extended it to all patients to have a bloodless medicine and surgery program that minimizes bleeding, controls bleeding, and permits us to do very major surgeries with very minimal blood loss and no harm to the patients.
Walking had become very difficult because the bilateral pain, was so bad. It was an important part of my life and my wife. Every Saturday as a Jehovah's Witnesses, we would share in the ministry. I would normally be able to walk for an hour or two without difficulty. But at this time, the pain was so bad in my legs that 10 minutes, one side of one block, that was all I could do, and I wanted to do more. It's just something that's a part of me.
I saw Mr. Samuth in the office in post-operative follow-up at 3 weeks after surgery, and most recently at about 2 months after surgery. He did extremely well. He resumed his activities normally almost immediately, did not require analgesics, and has returned to full-time work and activities without restriction. He's had a great result.
The day after surgery, as Dr. Steinberger promised, the pain was gone. And I was able to throw the cane away. I had my own cane mutiny, and I'm so glad to be free of it. I'm really indebted, to a dedicated professional like Dr. Steinberger, and how he helped me personally and gave me back a fuller measure and quality of life.